Morning, everyone. Thank you very much for coming. My name is Danica Kassar, and I am a health psychologist. And I will be speaking to you a little bit about our masters that we have upcoming. And you can use it for any questions you might have. For what we're going to do, I prepared some questions in advance that we've been getting, and I'll be answering through those. And then, if I didn't cover anything that's on from what I discussed, please feel free. We'll dedicate some time for it to ask any questions you might have and be able to answer it right there and then, okay? I'm just going to put this one here so I would not have to hold it. Is it better like this? Okay. So basically, we have launched our Masters in Health Psychology. The licensing body is Domain Academy. We are at Domain Academy here at the moment, and it is in collaboration with Willingness Team as well. And it is a combination of academics and also practice-based, all right? So let's start slowly. So how long is the Masters? The Masters will be 3 years long, all right? It will be done on a part-time, and this is why it would be 3 years long. So it would allow you to work alongside your studies in order to be able to continue gathering practice as well, apart from the knowledge as we go along. So the Masters will be 3 years. And when it comes to paying, you can pay in installments. Correct me if I say anything which is not okay in terms of this. You can pay in installments, so as you progress, you'd be able to afford and be able to continue invest in your education, okay? When it comes to where the lectures are held, this can be one of the rooms, all right, of the lectures. So all the lectures will be held here at the Domain Academy, and we will be here over the weekend. So it will be 1 weekend per month, which would be a Saturday and a Sunday. On Saturday, we'll be here from around 9 till 6 p.m. And then on a Sunday, we'll be here from 9 till 5 p.m. So we will be having 1 weekend per month. There will be a month or two where there might be another weekend in addition. So we'd be able to take a month off for you to be able to relax a little bit without assignments and stuff, okay? So that's how we will make it work in order to be able to achieve the needed credits in order to be able to qualify in terms of the eligibility for the master's criteria. So like I said, the lectures will be held here. There will be tutorials. This room can change in order to what we need it like. So there will be tables. There will be group discussions. So they would be here. And obviously, the way we are doing it, it needs to be face-to-face in order to enrich and have conversations together, because there will be academics, there will be experts in their field that have been working in this area for a very long period of time. However, the best kind of learning is also peer-led in discussions between us. Come in. So, with these masters, who can you work with? You can work with a lot of people, a lot of groups. So first and foremost, if your background is in psychology, you can continue on your route to psychology, becoming a health psychologist. If you use this masters, as a health psychologist, you can work both in hospitals, in community clinics, in private practice, as well as in other kind of organizations such as schools, NGOs. I believe health psychology has a lot to contribute in every area, even though we associate health psychology a lot with hospitals, which is where it originated from when it comes to health behaviors and health conditions. I believe there is a lot that health psychologists can contribute in different fields. So be it school, for example, I do believe a health psychologist can contribute in a way that, because educational psychologists, child psychologists would not know everything under the sun in terms of children, and children would have different needs. So you might be working with a kid which has physical health issues or disabilities. So this is why road is endless when you do a master's in health psychology because it can lead you to open up in a lot of areas. I believe also, for example, health psychologists have a place in prison. It doesn't need to be only forensic psychologists because obviously, again, forensic psychologists would have been trained on dealing with the behavior and situations and the law. However, as we know, people that are, for example, in prisons might have other needs, other psychological needs, such as addictions or their own physical health issues, which would benefit a lot if they were to talk with a health psychologist, okay? If you...
And even I think where we're heading as a society, everyone is becoming more health conscious, and people are realizing that a lot of people need help with motivation and things like that, even in private practice.
Cool.
That's why when we were deciding what kind of psychology, we went for health psychology, because in Malta we feel that there is a need for health psychologists in the public sector and in the private sector as well.
Cool. And I'm very passionate about health psychology, okay? So I can talk about this till tomorrow and we can have our first weekend here. I believe health psychology has a lot to contribute. So Matthew mentioned motivation. We hear the word